Matt, you want to start us out?
Sure. Hey, good morning, everyone.
Morning.
Welcome to another exciting episode of Proactive Health Collective of Keene. We are here every Friday bringing you just a little bit of perspective from various alternative disciplines here in the healthcare options of your Monadnock community. And today we have a very special day. We're just going to freeform over what it is that we've been seeing in practice lately and go from there. So the chat box is open in Zoom if you have anything specific you'd like to hear. And why don't we just run around and let's introduce ourselves real quick. Allison, you want to go?
Sure. Hi, everyone. I'm Allison Millar. I'm a licensed acupuncturist. I practice in Keene with everybody else here. My business is Basic Balance, and I use acupuncture in all 5 branches of Chinese medicine. So nutrition, a little bit of Chinese herbs, body work and exercise, lifestyle recommendations to kind of paint a full picture and work with my patients just to help their bodies help themselves, stimulate their body's own internal healing.
Yeah.
And
I'll go next. Becky Montrone, and I am a holistic health practitioner, nutritionist, herbalist. My business is Wondrous Roots, and I'm at the Miller Forge building on Roxbury Street up on the 3rd floor.
Cool. And I'm Dr. Tisa Abatelli with the Cheshire Wellness Center, also in the Miller Forge building, but on the 1st floor. So we're friends, obviously. And we are a holistic chiropractic office that specializes in reduction of tension within the nervous system, not your traditional twist, turn, rack, crack, pop of the spine, but really just creating more out of life and what people can get within their body and their mind and their spirit.
And I'm Dr.
Matt.
He's married to her.
Yeah, and we're in this.
Yeah.
Great.
Okay, so we're missing Dr. Jean today. Dr. Jean Clerkin of Monadnock Natural Health is not with us today. And so he'll be back next time. But anyway, he's wonderful practitioner here as well, right here in downtown Keene on Church Street, Monadnock Natural Health.
Beautiful. So with what's been going on in our communities and in the greater world lately, it's provided, so in one way it's this crisis of this pandemic, and at the other time there's this tremendous opportunity that has happened. And one of the things that we hear continually, and I'm sure that everyone does, is that everyone who's coming in here has more time on their hands than they have. And that has produced more time to reflect and to introspect on both themselves and their lives, what it is they want to see in the world, what it is that they think is possible for themselves and their health. And also the reduced, spending on the sort of like material economic shiny objects has given people the resources to, I think, invest personally in the things that do matter more. And so we're seeing a lot of that. We see just up here in this beautiful region of New Hampshire, we're seeing a lot of people are scooping up real estate. It's a boom up here. We have so many people moving here, and lots of reasons for that. So focusing on what really matters. So that being said, we're all seeing a lot more people right now. And I think that there's probably some trends in terms of what it is that we're seeing come into our offices and what people are really looking for. And that might be relevant to those of you who are watching, what it is that you might be able to relate to. So I'm just curious, Allison, Becky, and then of course, Dr. Tisa, what are we seeing right now that's coming in? What are some of the themes that are going on in the community right now?
I would have to say, I don't see what you're seeing, Matt. I don't see that. I don't see people having tons of time and really chilling out. I see a lot of confusion. I see a lot of fear. I see a lot of suspicion. And I don't, my practice has just been booming, but not because of COVID, but because people have health problems that will just never stop as long as we're on this planet. People have very serious health problems and they don't go away. So we're not, just because something else happens, but I'm not seeing a real positive side. I'm seeing I don't see that. And I don't see people expressing that to me, I have to say. Yeah.
Sure. So what is the lay of the land for you then?
Well, I mean, I've got cancer all the time coming in here. I have people, somebody just was diagnosed with lupus, you know, we are dealing with serious illness of kinds that people have always had and are having. And these cases are just increasing. They're not getting any better. And mainstream medicine is not doing any better job of handling them and helping people really recover, really get well. We talk in mainstream medicine, it's all about remission. It's all about maintenance. It's all about management. It's not about you can get well. And so, you know, things like that. And that's what drives my practice is just people and there's been no, you know, people like us are always going to be in business because people are desperate and they are, and they're not well.
Mm-hmm.
Yeah.
Mm-hmm. How about you, Allison?
A lot of what Rebecca was saying, pain is probably the most common thing that I deal with. I'll always have back pain as number one, low back pain. And a lot of people are saying that the pain, things are just worse because there's more stress. There's more just like, it seems like there's a lot going on right now and people feel like it's heightening their pain. And I actually have had a new patient this week for jaw pain, and she had just come to the office after her dental visit, and the dentist said she has severe degeneration of the jaw. So like, imagine that you're doing this so much that you're actually degenerating the bone. You know, it's really quite amazing how our bodies will hold that tension. So yeah, I'm doing a lot of moving stuff, a lot of moving to like facilitate the stuckness that we're seeing that I think is exacerbated by a lot of just the tension in the environment. I mean, the elections next week, that's a big one for people.
Yeah.
I've had multiple people this week say, after next Tuesday, I think I'll be doing a lot better. Yeah. And then I'll get neuropathy is a big one. I was talking to Rebecca about this earlier this week. We were kind of collaborating. Like a macular degeneration case has been really interesting. Parkinson's, some weird sort of ones. Majority would be pain, abdominal pain, endometriosis, stuff like that.
What do you do for endometriosis?
It's tough. It's tough. We can treat the pain of it, but yeah, it's a nasty sort of thing because, as you know, it starts to form, it builds nerves, right? So it's literally like building like nerve areas in your abdomen, which is extremely painful. So like we can treat the pain of it, but I generally will have patients like listen to their OBGYN, do the surgical thing. If
Well,
that's what I recommend.
let me tell you what I do. And I had endometriosis, so I have a long history with this myself, but we use serrapeptase, which is a proteolytic enzyme to break down, it will dissolve that protein in those thick things in the, especially in the chocolate cyst, we call them, of endometriosis.
That's that silkworm protein, right?
Yes, it's a silkworm protein. And I mean, it's documented to have benefit for that. We definitely use iodine because you've got a big situation here of estrogen dominance. So estrogen dominance, we want to make sure we're metabolizing the estrogen down to its most benign, non-lethal form and locking that into the receptors. That's absolutely huge. Also using, a lot of people with endometriosis do not make enough progesterone during the luteal phase of their cycle. So we can use a natural progesterone during the second half. But also what I have people do is use, this was Dr. Christiane Northrup's suggestion in her book. It's right on my shelf, Women's Bodies, Women's Wisdom. She's a holistically minded OBGYN, very famous, actually in Maine. But I did this when I was menstruating, when I read this in her book, and that is to use this is a place where medication has its place, because she said what causes the excess pain and bleeding is inflammation. It's a release of the prostaglandins. So she said what you want to do is start your Aleve or whatever NSAID you're using, non-steroidal anti-inflammatory medication. That you start hopefully before you even begin to bleed, but at the very latest, as soon as you do, and go on a scheduled dose until you end. And so my periods went from like 8 days to 3, very manageable. And so you say, well, I don't want to be on, Aleve for 3 days. Well, you don't want to bleed for 8 days, and you don't want all that inflammation going on, and you don't want the blood loss and the anemia that comes with it, and, everything else. But I do think endometriosis is really important. It can be addressed outside of mainstream and just laparoscopic kind of burning stuff, lasering stuff.
When my thought on hormones, like supplementing with hormones, I was always under the impression that if you supplement with hormones, your body won't make them anymore. And then, like, that's it. What do you do when you don't want to supplement with them anymore?
So, yeah, you're talking about a negative feedback loop. And if that is the case, I don't care, because the main thing is just that you're getting them. And you are going to start making less of them. My father, compound pharmacist George French, used to say menopause begins in your 20s. Okay, because now you're making less DHEA in your glands, or your backup system for progesterone, testosterone, and estrogen. And these things are vital to our brain health. I don't mean mental health, but yes, but our brain health. Okay, so for preventing things like dementia and Alzheimer's and things like that. So one of the big anti-aging things we do is we safely go in with bioidentical hormones and just make sure that we keep those levels there. And that prevents a lot of health problems, and very, very safely. With melatonin, that's been always the thought. If you use melatonin, you're not going to make your own, and that's been proven wrong. There is no negative feedback loop there.
Oh, interesting.
Yeah.
Cool. Yeah, melatonin's an interesting one. I know that you use that for like anti-cancer properties too, right?
Yeah.
That's cool.
Yeah.
Yeah.
So Allison, something you said earlier on, you were talking about the overall lying tension. And I think that, if we're taking a look at, so we live in a, Western medical model society, where the disease is something to get rid of, the symptom is something to cover up, or just to get back. I just want to get back to where I was. So it has this perspective always on looking back toward the past, rather than looking toward the future as a general model. So that's sort of where we're coming from. And then, we talked about tension. So the example of the jaw there, and then looking at that in terms of where that comes from, and how heightened that is right now. And in our work, we look at tension with 3 umbrella categories, and we'd love to get some perspectives on this. So we look at one of the umbrella categories of tension is coming from physical. So that's occupational, that's postural, habitual, accident, or any sort of other thing that would cause some sort of physical strain or tension in the body. And then there's the mental, emotional, or the thought-driven tension. So that's anything that we didn't have the opportunity to process because, life was too busy. We had to step up. We said, I'll deal with it later. There's an election coming up. There's, something else that's going on, has gone on, that we haven't been able to address. And then the last one, which is a little bit more tricky to pin down, is chemical, right? So not just the air, water, and food that we consume, but also the medications, sometimes even supplementation that we're on, and then how all of that can sort of mount up. And I know as alternative practitioners, a lot of what we all do, is play cleanup from a lot of, attempted chemical intervention. So Dr. Thyroid, I know you can talk to this too. How do you see those things playing out?
Yeah, I have a patient, I think I talked about this in previous webinars. I'm still working with her with, it's that It's the syndrome where when you get off a boat, you feel like you're swaying, and she feels that all the time. It's significantly better. She just has like a little bit of wobbliness now. But what we really realized was the turning point was when she was able to discontinue a pharmaceutical medicine. You know, of course, working with her physician to decrease the dose and then get off safely. But that once she did that, she started turning the curve significantly in the right direction. Yeah, and I see that quite frequently. Antidepressants is another one that I'm working with somebody. They decided to get off of them themselves, but there's a lot of work to do with the gut health, especially to just kind of rebuild what's been damaged by that. So yeah, that's a big one.
Yeah, that's the first thing I look at when I'm working with somebody is their medications, because some of their presenting problems are medication side effects, but they don't realize that that's what they are. And so, you know, not always, but you know, I always go through the list and I look at what they've got going on, and I look at side effects, because that's the first thing you want to, you're going after a problem that really is being caused by something that could be changed. And sometimes a person might need a medication, like say it's a blood pressure medication, but maybe that blood pressure medication that they're on is causing their particular problems, and a different choice could be made. So just even bringing that to their attention so that they can bring that to their doctor's attention, because a lot of times people have more than one physician prescribing medications. Doctors are not really knowledgeable in pharmacology. When it comes to, you know, you're better off asking your pharmacist about, you know, things like that, because they really aren't. They know what they're supposed to prescribe for different things, but sometimes they don't get the interactions of them. Mm-hmm. And my dad, who was a pharmacist, said, used to tell people all the time, never take any more than 4 prescription medications at a time, or your health is just going to go down. Mm-hmm. You know, yeah.
Yeah, that makes a lot of sense. You know, and it's interesting. We have a pretty long-standing practice member who she has been on, I believe, an antidepressant medication, anti-anxiety for the last 7 to 8 years. And she just decided within like the last couple of months that she doesn't want to take it. So she started very logically, like, reducing it at a certain pace, you know, like taking it, you know, if she was taking 2 pills, she was down to 1 pill a day, and then gave that a week or 2, and then went down, you know, just decreased the dosage, not only in the strength.
Yeah.
Huh? Say that again?
Yeah, she followed her doctor's recommendations on how to decrease.
Yeah, like properly decreased. And
that's called weaning. It's called the weaning.
Right, there you go. And she would get on the table, and we see her a couple times a month. And I think Matt and I were both like, what's different? Your system's very, very different. And because we just felt her body and how it started to change. Like there was just something that I was like, I haven't felt this before on you, or it felt like, it just felt different. I don't know how to explain it exactly, but it just felt different. And so she's like, actually, it's interesting you say that, because I've decided to wean off my medications, because I feel like now is the time to give my body a fighting chance. And she's also a health practitioner. And so how the body has been shifting in a different way and releasing the tension in a different way since going down on this medication has been very crazy. And she's seeing breakthroughs. She's having, you know, there's a lot of emotion coming through on the table. You'll see the movement of her body. Like she really is connected. She gets up with tears and she's like, oh my gosh, that was a great release. You know, it's the chemicals are starting to shift in her system, and so are the emotions. So she's now like actually feeling things, which is very cool, because when we see people come in and we do the heart rate variability test, which basically tests the correlation between the nervous system and the cardiovascular system. Are you living in fight or flight? Are you living in the rest and digest aspect? Is there a balance? What's going on, and how is it affecting the functionality and the responsiveness of your heart. Dr. Jean talks about this a lot, and we do the same thing. And we can see, like, people who are on antidepressant and anti-anxiety medications will have a really good reading, which is good. It's not good, but it's a false reading because their medication is actually doing what it's supposed to do, which is good. And it's not letting them actually see where they're really at. And so we, medicine is necessary when necessary. We always say that. And I'm not here to like tell people to get off medications by any means, but we have to be realistic. Like, this may not be an accurate reading because you are on the medications. And so, and it doesn't shift when we have some people who are still on their medications, and then we'll do the testing over a period of time, and the score is roughly the same, or it's in the same position because their body is still in that particular state due to the medication. However, other things change, which is cool. So the chemical toxicity is really big. And then Becky, you make a really valid point on, your medication could be the cause of your symptoms or the concerns that you're having. And right now, if I share a personal story, my mother has been going through a challenging time with breathing, and she doesn't have COVID. She's been tested. She went to the hospital, and like they kept testing her for COVID over and over and over. And she's like, I don't know. She was sick, fever and chills, vomiting, nausea, all this stuff. And at first they thought she was septic. So she went into the hospital and was like, I might be septic. Well, they just looked at the respiratory concern because they were looking for COVID. And then they didn't find it. So they dismissed her with no answers. She goes back in a month later, same kind of concerns. And they still test for COVID for the first like day and a half. And then they finally go to, well, let's do an abdominal CT and see if there's anything going on. And I was like, well, what if it's the toxicity of the medications that you're taking, and your body is just not getting a chance to process and do what it does naturally. And they're like, no, that couldn't be it. That's not the answer. They're like, if it's not COVID, then it doesn't make any sense. And I'm like, oh my gosh, let's take the blinders off and actually go back. What if COVID wasn't a thing? Then what? You'd actually have to look for something different. So not that medicine is necessary, because they find things and they're not worried about it, which I'm really glad. There's other things going on, but it's the chemical toxicity is crazy and how it affects the body, especially when we start to decrease our intake of it and let the body come back online.
Yeah. When I was in graduate school, we had like clinic sessions, and we get a different clinic supervisor every semester. And we had a gentleman visit from China, and he had been working in a hospital in China for years. So in China, they use Chinese herbs and acupuncture alongside Western medications in like the same hospital setting. So he had a lot of experience with these things together. And when he would go into the clinic room, he would take the patient's pulse, and he would be able to name the exact medication that the patient was taking. So it changes your state to the point where the diagnostic reading, where you're going to decide like what organ imbalance is going on, is actually not, it might not be what's actually going on.
Right.
So yeah,
Right.
you keep that in mind.
Right. That's what like Tisa was saying.
Right.
Yeah. It's like you're getting this thing and it looks like you're in this chill zone or whatever that is that you call it, but as opposed to the fight or flight or the rest and digest or whatever, but it's a fake reading.
Right.
And so, I mean, maybe the good thing is that the medication got you to rest and digest, and that's helpful for you. Okay. You could look at it that way, but then what you're saying, like Allison, is if you are going in to diagnose somebody, and I know I am blown away by traditional Chinese medicine and doctors, because I mean, they can basically, you don't have to, somebody who's really good, you don't have to tell them what your symptoms are. They take your pulse and they look at your tongue and do all this stuff, and they'll tell you what your symptoms are.
Yeah.
I mean, it's like brilliant. It's so amazing. But for that person to be able to, from the pulse and stuff, understand what pharmacological things they are using is, that blows my mind. That,
It's
wow.
it's so important from a practitioner's standpoint to know that, because I mean, even probably a Western practitioner too, because you're, well, maybe not, because it's a different sort of thing altogether, but you know, say, yeah, you just, if their liver pulse would normally be screaming and you need to sedate it, you need to get it moving, but you wouldn't know that because in the pulse, it's like, la, 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 I'm so happy and free and easy. Then how do you ever get them to the point where they're going to be able to get off of their medication if their liver isn't like taught by the nervous system, by your treatment, that it, how to be in that other state? Do you know what I mean?
Right.
It's like being done for it, so it doesn't actually get to learn how to do it.
And Allison,
Yeah, there's a,
when you say liver, you don't mean the organ liver, right? You need
The organ system, which is, yeah, in Chinese medicine, which means a lot of different stuff. Yeah. Yeah, different language altogether. But yeah, that brings me to something else I wanted to say about your initial question, Matt. Like that's really interesting. You guys have the different patterns of tension. So you have the physical and then the chemical, which we talked about, and then the mental emotional one. Yeah, in Chinese medicine, the physical and the mental emotional, they're one and the same. So it's like, for example, if you have like liver qi stagnation, that's going to present as like upper neck and shoulder tension and that clenching of the jaw. Or if you have like a kidney qi deficiency, you'll see that as low back pain and knee pain. So it's really, yeah, we talk about that all as just one
That
organ.
is so fascinating. That is so fascinating. That's why I love these sessions, just for me,
Yeah.
for me. It's
Well,
like
that makes
we get to go out we're going out for a late breakfast or something, and we're just sitting around the table because we don't have time during the week in our busy schedules to like, oh, Allison, explain that to me, would you?
right.
You know?
The spleen governs the muscles in the body. So fibromyalgia patterns. I've done really well with fibromyalgia. I really enjoy treating it because it's like
Really?
textbook. Yeah, it's like spleen all the way, and it's like muscle pain. And yeah, I mean, that's another one that I have a patient that was terrified of needles, and her first treatment was 2 weeks ago, maybe 3 weeks ago. And she couldn't stay on the table for more than 15 minutes because she was just like really anxious.
Freaked out.
Really freaked out. Yeah. And she drank too much water, so she had to go to the bathroom too. But she like did it, and then she came back, and she has been just so happy with it. She's like, you're awesome, and I just feel so much better, and it's just so cool.
Let me ask you about that.
And now she just like totally relaxed. She like falls asleep every time, and she loves it.
Wow.
Yeah.
Now let me ask you about that. She's fibromyalgia.
That was one of the diagnoses that she got. I'm not
Now,
sure.
do you notice, in addition to the muscular pain relief, all of that pain, what about the other things that come with fibromyalgia, like extreme fatigue, depression? Do you see kind of it all sort of lift?
Yep, the fatigue is lifting for sure. Her outlook is absolutely lifting, and we've like kind of talked about that too. But yeah, she's been in such a better place. Yeah, you see all across the board, she's getting improvement.
Wow.
Yeah, makes a lot of sense. Like if you're balancing that chi, if you're bringing the systems more online, like, and it's balancing and they're healing. As they heal, the brain and the body are connecting. So the organs are starting to function again. Therefore, the muscles are starting to function better. And when you're in constant pain, it's really hard to have a good outlook, right? And
Yeah.
so, we see it all the time. And then some people, like after a while, like they're like, oh, I finally like this let go, or this moved, or this shifted, and the outlook starts to change. And a lot of people are finding out that like attitude has so much. That's the emotional part of tension. Like fear is huge right now. It's a huge emotional tension right now. And so if we're in fear, fear is going to grip us. That gripping is going to create a physical pain, possibly in certain people. Like, I'm not saying it's going to, and that's how it does it, but it could show up in many different ways. But it really is like, it's all related. It's all tension. We feel on the body. We can run fingers through over the muscles and be like, this is more of a chemical issue, a chemical toxicity. We had a couple come in, and one of the ladies was, you could feel her body and you're like, oh my gosh, you have so much chemical tension. And she's like, yeah, right after I got married, I blew up and like I got really heavy and I started having all these problems and her hormones were going crazy. She didn't have a period for like 2 years and all this stuff. And then her partner had a ton of emotional tension in her body. And so we talked about her background and what her life story kind of was and what she thinks happened right before. And she explained like she had a very traumatic situation happen with family. And so like the two of them were just like exact chemical, exact emotional. And what they saw as they started to shift, because I had them come in regularly, and they were the chemical one was like, oh my gosh, my period just started and now I'm feeling this again. And she's like, what else is going to happen to me? Like all these things started functioning again, which she hasn't had in a long time. So she's like, is this normal? And I was like, well, yeah, your body's supposed to do that. It's been blocked and it's been stuck. It just hasn't been able to function like it's supposed to. So
Wow.
Yeah.
people see crazy, crazy things with when their body starts to function better.
Yeah, and you're right, it's so related, and you can start in one area and then the rest, it's like a cascade effect. So the way that the language that we have to see all the relations, we have the 5 element cycle. So the fire is like the heart and the small intestine, spleen and stomach, lungs and large intestine, kidneys and bladder, and then liver and gallbladder. And each of these elements kind of feed into a cycle like this. They kind of nourish each other, and then they control each other like this. So it's kind of like a checks and balances within that. And so if you have a problem like over here, if you start to resolve that, now this element is going to be able to nourish this element. And now maybe because this element's nourished, this element over here doesn't need to like keep it in check. It doesn't need to like work overtime and do its job. So then you'll see relief in that organ system too. Yeah. And that's why all of our medicine is awesome, because you can start somewhere and the body can run with it. The body can know what to do, because it's like, oh, okay, there's space here. I can like work it out.
I gotta say something really cool. Now, we've talked about these bioenergy discs before. And Allison, you were the one who first brought them to my attention. They look like this, right? And they have them for all different things. So these are programmed with frequencies of whatever nutrients or whatever things go in there for different purposes. This particular one is for migraine. But I have to tell you, I had really good response to the thyroid one, which is exciting me so much because thyroid problems are rampant today. Probably 75% of the people I see, adults for whatever reason, have a thyroid issue. And a lot of that has to do with iodine deficiency in our country and things like that. But I had a woman, I've been working with her for several years, and she did well. We got the nutrients in there to help with the thyroid, and she was able to lose a lot of weight, and her constipation cleared up and things like that. But she just started trying these patches a few weeks ago. And on the first day, she goes, oh my God. She's like, I feel like myself, like before I ever was hypothyroid. Like I feel bright, my brain fog is gone, energy, right? So she had a coworker who was saying, I don't know what it is. Is it my thyroid or what? She said, I go home, all I can do is barely like drag myself to the couch. And, that's it. And just kind of struggle through. And so my client said to her, well, try one of these patches. I don't know. She goes, so she did. And the next day she came back and she goes, I can't believe it. I got home I was up doing stuff till 12:30. It felt great. I did my mother's bookkeeping. I did, blah, blah, blah. I slept great. And I'm thrilled because thyroid is tough. Because even if you get somebody their thyroid hormone replaced with medication, it doesn't mean that the body can use that. There's a huge problem with conversion from T4 to T3 and all of this kind of thing. So I am super excited about this particular patch because it's not going to care if you're hyperthyroid or if you're hypothyroid. It's not going to care because these are frequencies and your body's going to use what it needs and adapt to you. So I just have to share that. I don't know. We'll see how it goes with other people, but thyroid is tough.
Yeah. And those patches are cool because you're not introducing another substance. So there's no
Right.
side effects.
Exactly.
It's going to work, or like it's going to help you, or it won't.
But you're not going to OD
And what we're
on
finding-
anything. Yeah.
What, Matt?
Yeah.
Oh, I was just going to say that, what we're finding now in terms of, your body's operating system. So your neurology is master control, the brain, the spinal cord, which is really your brainal cord because it's made out of the same cells. We're finding that everything's based on tone. It's an acoustic frequency. So that makes total sense. This is not what you're going to find, in a medical institution that's based on the research from 10 years ago. But what we know right now is that there's no heat given off at a synapse. We've thought it to be electrical this whole time. The truth is that all the math matches up with acoustic wave. So if we start looking at tone, frequency, and all these things, it makes so much sense. And with the thyroid, what we find oftentimes in chiropractic is that there's degeneration right there at that part of the spine that innervates the thyroid. And in the West, we just consider calcification of the thyroid as a normal part of aging. Now, maybe that's true, maybe it's not true, but it seems a little bit of a coincidence that we have some challenges there in terms of diet, and then also just the very innervation of that organ because of the degeneration, because frankly, that one part of the spine, which is also associated with having a voice, having trust in relationship, and all these other social applications, tends to try and bind energy, hold the world up. And as it does that, it starts to literally get crushed. And so we run into all these symptoms.
Yeah. And I recommended somebody with thyroid issues to see you guys because I regularly, as I get people on iodine, I show them this, it's a brief explanation by a chiropractor about when you start iodine supplementation, your TSH level can look like it's going way off and you're becoming much worse because TSH has another role, and that is to get iodine into the thyroid. So he does like a 6-minute little thing on this. But he said, the first thing we do when we're working with people is we deal with, the subluxations and the things up here in the cervical spine and things like that. And so I was playing that video for her and I was like, yeah, have you had any kind of care? And that's something for me to remember to talk to people about because these things all, it's not just one thing. Rarely is it one thing. It could be the perfect storm. Okay. You're low in iodine, but now you've got issues up in here. And so your thyroid it can't possibly do what it's supposed to do.
Which is why it's good to have a combination of practitioners as your healthcare team, because there's no one person or one practice
Modality.
Modality that's going to cure, which we're not, but that's going to fix, your problems, because it's not one thing. We are a whole complex system.
Yeah. And the more ways you can reinforce the same thing in different ways and different modalities, it's just going to make it so much easier for your system.
Allison, what do you do for people? Do you work with people specifically for thyroid, or what do you find? What do you hone in on?
The spleen, it's a different language, so it's kind of hard to explain it, but spleen and kidney are usually very much involved. And in a hypothyroid situation, it's the yang of those organs, which yin is inward, downward, rest, digest. Yang is upward motion, circulation, metabolism. So it's the spleen and the kidney yang is lacking. So it's kind of,
Yes.
we call it like in Tai Chi, like the Ming Men, it's like the fire under the cauldron. So you just got to like get the fire going. Hyperthyroid is a little bit different. That's like, there's a lot of empty heat in that. It's like, there's a lot of like there's blood stagnation. So you want to get that moving too. But yeah, it kind of depends on how it presents.
It's so interesting that you say like the fire, right? Because people who are hypothyroid have low body temperature.
Right. Yeah.
That's one of their big ways, is that you're hypothyroid, is just to take your morning basal body temperature with a basal thermometer and track that. And there's a certain range, and if you're just consistently below that, and people with hypothyroid will have cold hands and feet, and are often feeling cold. So that's so interesting. Yeah, light the fire.
Yeah, it was so interesting what you were saying, Matt, about the degeneration at the vertebrae that innervates the thyroid. So when I see a patient, I treat back pain day in and day out, and it doesn't really, I want to know the vicinity so that I can use like a mirror image, right? So you can map, say you're using the hand as your mirror image, you can map the low back here and the neck is up here. So I want to know like where it's located, but I don't really care like if it's T3 or T4. It doesn't make a difference to me, but that's super cool that you can like see what organs are connected to what vertebra and look at that more in like the physiological function of that.
Yeah, we're very concerned with exactly where it is. Let's say not only is it T3 or T4 or C, 4, C5, but is it 4 in relationship to 5? Is it 5 in relationship to 4? How is that traveling through? How does that overlay with the rest of the spine? And you could say that, yeah, if you sort of like get a ballpark, you're going to have some results. And there's a lot of chiropractors who practice like that too. To be honest, it's like there's sort of a fixation model. Like if the bone's not moving, just apply a force and crack it and get it moving, and then the body may regulate itself after that. And there's nothing wrong with people who do practice that. And I think that one of the things that you probably have is a guidance in specificity. So with your roadmap being different than ours, I would imagine that if you're kind of looking like back and forth because of the way that lines up, you probably are being pretty specific.
In a different way, but yeah.
In a different way. Yeah, exactly.
Yeah,
in a different
which is why it's
Yep.
so cool to, yeah, it's all different language.
Mm-hmm.
But yeah, could you say like, say someone comes in with a herniated disc at L2, like would that give you a hint on what might be going on physiologically in their body?
Oh, yeah, definitely. And the big thing to understand about herniated discs is that so the system goes through, this is the pattern of tension, okay? So an input from the environment comes in, and then the first thing we do is that we reach into our past to say, do we have any reference for this on how to handle it? This is what's happening mentally, physiologically, emotionally. If we don't have reference for something, then the next thing is, well, can I fight or flight it? And if I can't fight or flight it, then then we like can try to fit in with it. Like, well, what if I just sort of like, find, my way in there and see if I can fit in. And if that doesn't work, people will then try to control it. And if they can't control it, the next thing they do is that they literally curl down on themselves. They protect their heart. The head comes forward, the tail tucks under, and they go to protect whatever bit of energy, emotion, life force, like heart they have left, basically. So it goes into total survival mode. It's a double-ended tension. It's really, really intense. It generally starts out with that lower part of the neck that never had a voice, which is associated with the thyroid, and then with the tail tuck. So that's where it goes first. And then after that gets really bad, it goes all the way up to the very top, and it cranks that right into the back of the spinal cord, which is actually the tension pattern of COVID. Ouch. And so when someone herniates a disc, they've got so much tension on their system, the body's literally blowing a disc to be able to make more space for the spinal cord. It's so cranked. And then we look at that one disc as an island to treat. And the truth is that if you treat that one island, they're going to blow another disc. Like, you have to look at the global picture of why they're having this response, how they got through all of that tension cascade to this point in the first place if you really want to be able to create a system that's flexible, resilient, and not going to do that.
Wow.
That's cool.
Yeah,
Yeah.
no, I never thought
Yeah.
about somebody slipping a disc because the as a health the body's way of taking care of itself.
Right. I find
Literally like letting air out of the tires.
I find that for back pain especially, most of the ways that I treat pain, but back pain especially, distal seems to be more effective, meaning treating not local to the area of pain. So like using areas on the hand or the arm or the legs and the head, so you can get the system moving it through the back. I find that if you go to the local area, sometimes people respond well to that with, you know, the electrical stimulation, but a lot of the time it aggravates it.
Yeah, we find that e-stim just adds tons of tension to the system. People that have been on any sort of stim treatment, we have to unwind all of that. And it's intuitively, if you have a slip disc or whatever we want to call it, hernia, it doesn't matter. There's all sorts of different names and varying degrees. If you go right to the place where that's already happening, what you're doing is that you're going to a place where the body's in defense already. Like it's already has too much tension, already has too much pressure. It's already like gone into some sort of like, you know, less than optimal, unsavory situation. So to go in there and then try to fix it is like adding insult. It's like pouring salt in there. So when you look globally and you look for where the person has resource, which is really what we do. If someone comes in with back pain, I'm very sympathetic to that. But the truth is, like, I'm not going to treat your back pain. What I'm going to do is I'm going to find out where you have resource, where you have connection, where you're fully awake, aware, and alive in your system. And if that volume's at like a 2 or 3, we're going to crank it to 11. Because if we do that, that's going to go through that place that has the back pain. It will suspend that tension and their body can handle it from the inside out.
Wow, that's very well. The way you both told that was very insightful and very articulated so well. That makes all the sense in the world. Yeah.
Well, you have to think like we all work, you know, like think locally, but act globally. Like Allison, you know, you say you go to certain places and they actually don't respond. But if you're looking at the whole bigger picture to bring more things online, like it makes so much sense. Like our great analogy is that we're like a suspension bridge, right? Top to bottom, brain is connected here, travels through the hole in the head, goes all the way down, and it anchors to your tailbone. Like it literally is in your tailbone. And you have, if we're a suspension bridge, and we say this all the time, if one side starts to tighten and pull, it's going to stretch the other side, right? And so people may be feeling the stretch, but not so much the tightening, or vice versa. Everybody's different, right? With whatever their personal complaint is. And so it's like, but if I just focus, you know, on one aspect or the other, then we're missing the whole picture. And so the whole goal is to find out where, like Matt was saying, the resource, you know, where are you awake, what is working, and how can we let this learn to let go so that we become more balanced in how we function. It's not going directly to the problem because that may not be the major issue. It's where is their resource? Where can we help the body really access what will change the system ultimately?
Well, and that's the basis of Wondrous Roots. That's the way I work too, is that, you know, I have a woman who's had this horrible rash and nobody's been able to figure out what it is. And she came to see me a few weeks ago and we wondered about shingles. So then she just found out she just got diagnosed with lupus. So I saw her yesterday for a full consult, and what a wonderful lady. But I will say this, I'm not concerned about the rash. Okay. So it's not about the rash. It's about the immune system imbalance, because that's what I go for, is balancing the immune system. So now the rash will go away, right? It's not like we have to slather steroid creams on it, or we have to go, oh my goodness, this is a skin condition. It's not a skin condition. The skin condition is a branch. It's not the root. It is, you know, the outflow of something being really off. So that's what I do too. I try to go for what's really off, the root or roots, and then the branches will heal. They just will. Yeah. Same thing is what you guys are saying. Same thing.
Yeah.
Yeah, I took a bigger picture and look at the big thing. And yeah, Western medicine is amazing for emergencies and when you need a perspective, like a very specific perspective. What really frustrates me about the information that we get from the government and our healthcare system, it's like they're concerned about the air droplets, so you wear a mask, right? Like there's no thinking about how do you boost your immune system? How do you become resilient to COVID, which is quite frankly, it's everywhere. I mean, it's not going anywhere. It's probably already been here. Who knows? But why not talk
Become
about
resilient the same way you do to anything. And so then you don't have to be like, it's going to be the same answer for everything, so we don't have to worry about exactly what entity it is,
Yeah, and it's going to be helpful for no matter what.
Yeah.
Right. So yeah, take the perspective and make it a little bit broader. And then if Dr. were here, I know he would, he always likes to bring it into it makes sense about relationships, right? If you are constantly thinking about their fact that they don't do the dishes, right? You're just going to get so mad and it's going to be such a point of contention for the relationship. But if you instead, you're like, wow, he did the grocery shopping and, he does all of this stuff. But it's you put your attention in other places and make the field at a bigger state. And it's a great way to sort of achieve more harmony and peace, movement and freedom. Yeah.
I want to speak to that because coming back to the original statement that Matt had made at the very beginning, what are we seeing? What are we seeing in our office and who's walking in and what are they experiencing? So just to give you a different perspective in our office, people are not necessarily coming. There are still the people in severe pain. They're at the end of their rope. They haven't found any answers for certain things, and we're still seeing that. But I'll tell you, the majority of the people who have walked into the office, particularly in the last couple of months, I haven't been doing anything. I just got this comment last night when a practice member or a patient transitioned to a practice member coming on board and starting care. And her husband's like, we haven't been able to do anything. We have time, we have money, we've been saving up, and now is the time to actually take our health seriously. We can't trust what the government says, about our health. So it's really time that we take our care and our health into our own hands, which is brilliant because so many people are like, I need to do something different because what if this comes around again, which it possibly could. I need to be ready. My immune system needs to be boosted. I need to make sure that I can handle it and survive anything that comes in. So people are coming in because they want something different, and they know that what we provide collectively is something different, is to boost their system, to give them a more optimal chance of handling whatever physical, chemical, or emotional stress that comes into our being. And so we're seeing the complete opposite, more or less, seeing the complete opposite of people wanting more of something rather than the fear or trying to get rid of something. They recognize that, but they're definitely on board for trying something new and something different. And people are seeing amazing results, things they didn't even know were concerns. And you get rid of that one concern, that one complaint, and things just start to shift and open up in a dramatic, wow, I never even realized that this was a concern, but it's really not a concern. It's a completely different mindset. And so many people are like, I'm not sure if this is working, but I really believe that it is. I just have to trust my body, and I got to get to that point. We hear that a lot too. So they're looking for different things, which is what we provide. And that's beautiful that we get to work together to do it. I think, Becky, I just referred someone to you, and then you were like, she's like my best friend now. People are looking for more answers and for something more to really help them sustain a good quality of life as we continue to go through all these uncertain points that are coming at us.
I'd like to piggyback on what you just said too, like a offshoot. And that is, like you said, they have this one complaint, but then they start to feel better in so many ways they didn't really know they didn't feel well, or that they didn't identify as problems, but that was just what they knew, it's just what they've been living with. And it's the same thing with me when I work with nutrients and things, the things that I use for people, whether I'm using them for cancer or whatever, I'll be like, but you're going to notice feeling better in a lot of other ways, because these are nutrients or whatever that are so supportive to all of health. So you're going to notice, that's the wonderful thing. And I'm not saying that misuse of supplements and that no herbs are toxic or anything like that. I don't mean that. But what I'm saying is when I work with somebody, the things that I'm using for, maybe it's for, like I say, a specific health condition, will only help support the rest of your body and brain to thrive. And that's really wonderful, because it's the exact opposite of, we're going to put you on a medication, to help with this, but these are the side effects. Just watch a drug, all the drug ads on TV. These are the side effects all the way up to death, And so we say, first, do no harm. And there's a lot to be said for that.
They're promoting health and death. People still do it. Sorry.
It's not surprising if we're trying to, return someone to a prior state, trying to get rid of something so they can go back to where they were, put them in the past that might have side effects. Not surprising.
Yeah, right. If you're not growing, you're dying.
Yeah, it's about growth and moving forward. Everything's about momentum, and like Becky, you mentioned, balancing things out, and like, what is that? Creating, balance, creating harmony, creating coherence, so we have ultimately connection, gone from disconnection to connection, so that now the system has the opportunity to, like you said, actually thrive, because these add to connection throughout the whole system. And that's what we tread in our office, finding out where we're disconnected, bringing about connection and empowering that, so that the person really owns it in their physiology, their neurology, their outlook and interaction with their world and their relationships. Because without that, we're not moving forward. And we have to. So it comes down to, it starts out with, I really wish that I didn't have this, that I had less of XYZ pain, whatever symptom or experience. And what it ends up being is that suddenly, like you said, Dr. T said, that when something shifts, all of a sudden they realize, like, oh, what about this? And it literally goes from less to having more. And when we go from wanting less to wanting more, then we put our eye on the future. And when you can see a horizon like that, whether it's the big picture or just the next step, you're headed in the right direction.
Yeah, that's a message of abundance. And I think what you're saying, that was very well said, Matt. It's like, I want less of this thing that's bothering me, this health condition or whatever. And you're like, no, just don't settle for you want less, want more health, want more vibrance, want more just to explode into fullness,
One of my favorite questions I love to ask people is, well, so if you could turn your pain into something, what would you want to turn it into? What would you want to turn it into? Like this symptom, that, whatever they're coming in for, like, what would you want to turn it into? Because it will instantly shift the state from wanting to get rid of something to wanting to get more of something. When someone can get their eye on that, magic happens every time.
Wow. Nice.
Cool.
Given the possibilities. What's
Good way to wrap it
possible?
up, maybe a good way to wrap up our session. We're coming right up on the noon hour. So great. I've enjoyed this, comrades, colleagues, and friends.
I learned a ton today. Thanks, guys.
Yeah.
All right. All right. Everybody have a great weekend. Happy Halloween. Don't forget to set your clocks back. Fall back tomorrow.
Fall back.
All right. Fall back.
Awesome. We'll see you guys next week.
Okay.
Bye.
All right.
Bye.
Bye.